Do you experience symptoms of fatigue, nausea or dizziness? Do you suffer from joint pain, headaches, swelling, skin redness, or rashes? General malaise? Are you a woman? If you answered yes to one or more than one of these questions, you may have an autoimmune disease. Autoimmune diseases happen when your immune system malfunctions and attacks itself. Autoimmune diseases can affect any part of your body and have a multitude of types with different symptoms. Some common autoimmune diseases are rheumatoid arthritis, type 1 diabetes, multiple sclerosis, and lupus. There are over 80 known autoimmune diseases, and most of them are chronic and have no cure. About 50 million Americans are affected by autoimmune diseases, and approximately 80% of those people are women. While most autoimmune diseases are incurable, there are treatment options available. However, treatment typically requires a diagnosis. If you haven't been previously diagnosed with an autoimmune disease or know someone who has, there are some things you should know. There is no singular test for autoimmune diseases. The diagnosis process is lengthy and oftentimes filled with uncertainties. You may receive a lot of no's before a yes. Receiving a proper diagnosis will likely not be easy. Misdiagnoses and dismissals are unfortunately common. Doctors may fail to take you seriously for a variety of reasons, including weight, medical history, coexisting health conditions, or other factors such as stress. A survey by the Autoimmune Association showed that 45% of autoimmune disease patients were labeled as chronic complainers or were told by doctors that they were overly concerned over their health. The association reports that on average, autoimmune patients see 4 doctors over the course of a 4-year period before they receive a diagnosis. Different people are at different levels of risk for developing an autoimmune disease. There are genetic and environmental factors that may influence your risk of autoimmune disease. If you or a loved one believe that you may be suffering from an autoimmune disease, an accurate diagnosis is the first step to proper treatment. Given the complicated process of obtaining such a diagnosis, the Autoimmune Association has provided some tips that may help with the process. Know your family's medical history. Keep track of all your symptoms, even if they seem unrelated. Do your research when looking for doctors. Ask people around you if they have any relatable experiences or referrals. Seek out a thorough clinical examination. Given the difficulty with diagnosing autoimmune diseases, there may be multiple different tests that you will have to undergo. Ask for the results of any tests or procedures you undergo. Doing this will allow you to take your information to other doctors if needed. Don't be afraid to seek out multiple opinions. Doctors may have different opinions about the underlying cause of your symptoms. Some doctors may be less willing than others to run tests, and some doctors will not take your symptoms seriously. Establish a treatment plan with your main physician. Even if you have multiple healthcare providers involved in your treatment process, it may be helpful to designate a main provider to help you organize and manage your treatments. Prepare yourself for the future. Due to the uncurable nature of most autoimmune diseases, you want to make sure that you have a plan to deal with a future of treatment, side effects, and symptoms. Ask your medical care team about support groups. Take charge of your health. Don't let your symptoms rule your life. There are treatments available for you. You just have to seek them out. Well, that was a lovely commercial about autoimmune diseases. Let's take a more critical look at some of the aspects of autoimmune diseases, such as at-risk populations and diagnostic challenges. Autoimmune diseases are hard to diagnose, and oftentimes the causes behind them are not fully known. more comprehensive study of at-risk groups, factors impacting access to medical care, underlying causes, and barriers to treatment is necessary to understand why and how these diseases impact different groups of people. Given the groups most affected by autoimmune diseases like lupus, it is clear that there are likely other contributing factors besides biology. Race, gender, and socioeconomic status have been found to be linked to healthcare inequities. The diagnosis process for autoimmune diseases often becomes a lengthy process of elimination, as there is not a single test for all autoimmune diseases, and it sometimes requires patient advocacy. These aspects of the diagnostic process should be critically analyzed. Beyond the diagnostic process, discrimination based on race, gender, socioeconomic status, and other potential factors should be considered to understand why women, and women of color especially, are disproportionately affected by autoimmune diseases. Additionally, the occurrence of risk factors in more affected populations should be considered. While genetic risk factors are pertinent, an overemphasis or narrowed emphasis strictly on genetic predisposition or biology does not account for other risk factors or determinants. In the case of lupus, there has been research conducted showing there are other risk factors besides genetics that contribute to the high affliction and mortality of lupus among African American women and other women of color. There has been some scholarly work done to understand how and why African American women and other minority groups are disproportionately affected by lupus. Let's look at some of the examples of this type of work that has been done. The first study that we will be looking at is titled Racial Discrimination, Disease Activity, and Organ Damage: The Black Woman's Experiences Living with Lupus, Be-Well Study. The study examines the relationship between disease outcomes of SLE and racial discrimination in Atlanta, Georgia. The study considers psychosocial risk factors associated with SLE severity and mortality among Black women. Socioeconomic status is one such factor. There were geographic clusters of higher SLE death rates that were concentrated in areas of more poverty and higher incidence of racial minorities. Black women are more likely than white women to experience psychosocial stressors that affect SLE, such as poverty, unemployment, exposure to violence, and physical victimization. Environmental factors were also taken into consideration. The study states that Black women are disproportionately affected by these stress factors as well, as they are associated with racial residential segregation, poverty concentration, and environmentally linked deprivation. Variables that the study examined included employment status, insurance status, education level, and many others. The study found that greater frequency of racial discrimination was associated with increased SLE activity and organ damage. The authors of the study hold that these findings suggest that experience of racial discrimination contribute to racial disparities in SLE outcomes. The authors of the study argue that these and other findings suggest that racial discrimination is associated with biological factors shown to aggravate SLE activity, which over time accrue and lead to irreversible physiologic damage. They also state that their findings indicate that racial discrimination is a unique source of stress that exerts a negative health impact even after adjustment for socioeconomic variations and differences in health-related characteristics among Black women with SLE. The study highlights the need to combat and erase racial discrimination in society to take steps forward to reducing racial disparities related to health. The next study we're going to look at is titled Race, Toxic Exposures, and Environmental Health: The Concentration of Lupus Among Farm Workers. This study focuses on pesticide exposure among Black women farm workers in Florida to investigate how race and occupation are connected to toxin exposure and illness experiences. The study is based on the fact that low-wage workers of color are at increased risk for workplace toxin exposure and at higher risk for injury and illness. The study also recognizes that people of color working in low-wage jobs may have pre-existing health conditions, such as diabetes and heart disease, that could impact work-related illnesses. The study focuses on lupus as it is associated with exposure to chemicals such as pesticides. This study represents a more comprehensive approach to understanding the higher incidence of lupus among women of color. The study notes that women of color are more likely to work in jobs with high exposure risks and are more likely to be of lower socioeconomic status. The study also examined how these farm workers navigated the healthcare system and the obstacles they face. This is a quote from the study. The former farm workers pointed to a history of racism in the medical field to describe their experience with medical professionals in attempts to have their lupus diagnosed and treated. Low-wage workers, and especially workers of color, often face barriers in accessing and navigating care within the healthcare system, and low-wage workers are less likely to have health insurance. Besides systemic racism and socioeconomic status, low-wage workers of color may experience language barriers and immigration status barriers to accessing proper care. Pesticide exposure was rejected by medical professionals as a potential cause for their higher incidence of lupus, and genetic rather than environmental factors were assumed to be the cause. Farm workers reported experiencing discrimination in the medical system through lack of treatment, lack of meaningful care, dismissal over pesticide exposure as a cause, and being blamed by medical personnel on the basis of their lifestyle. Some participants argued that their doctors intentionally misdiagnosed them to, quote, obscure exposure illness connections, end quote. The study argues that the farm workers' exposure and illnesses were compounded by systemic racism, and that racial factors influenced the treatment and diagnosis of farm workers and how they live with their illnesses. The study highlights the importance of considering external environmental factors as well as internal biological factors when looking at diseases such as lupus. The study also highlights barriers to accessing proper diagnoses and care that individuals who are affected by these diseases may face. The next study we will look at is called Disparities in Lupus and the Role of Social Determinants of Health, Current State of Knowledge and Directions for Future Research. This study focuses on the relationships between race, ethnicity, and social determinants of health regarding SLE. The study identifies low socioeconomic status as a risk factor for poorer SLE outcomes, and these outcomes are more frequent in non-white groups. Socioeconomic status as a risk factor is also linked to poverty, lack of high-quality educational access, lack of high-quality employment, less access to high-quality care, neighborhood violence, toxic environments, and unfavorable social and community conditions. The study argues that exposure to social disadvantage and low social positioning can have detrimental biological effects over the lifespan that consequentially lead to poorer health outcomes. These factors must be addressed not only to address risk level and outcomes of lupus, but in terms of general health care and medical care disparities. Low socioeconomic status and poverty are found to be associated with lupus, regardless of race, but economic instability is not the sole determining factor in the higher incidence of lupus mortality rates among Black individuals. Home environment, racism, discrimination, abuse, stress, limited educational access, and adverse childhood experiences are all linked to poor lupus outcomes. Access to quality healthcare is another factor that contributes to worse lupus outcomes for ethnic and racial minorities. The study states that people with lupus from racial and ethnic minority groups, when compared with white people with lupus, are more likely to have limited access to high-quality lupus care and less likely to have medical insurance, both of which influence lupus disease outcomes. Quality of care may be linked to patient-physician mistrust, suggesting a need for solutions aiming to improve the patient-physician dynamic, especially among people with lupus from racial and ethnic minority groups. The study argues that further research on these factors and on more diverse populations is necessary to more comprehensively understand their impact on lupus outcomes. The authors intend this study to be read by clinicians, researchers, public health practitioners, industry leaders, and policymakers to highlight how social determinants of health, rather than just biology, contribute to higher lupus rates and higher lupus mortality among certain populations. The study emphasizes the need for changes to be made for more equitable health care and social conditions for marginalized individuals, especially those with SLE. The next study that we're looking at is titled Social Factors, Epigenomics, and Lupus in African American Women, SELA study. Protocol for an observational, mechanistic study examining the interplay of multiple individual and social factors on lupus outcomes in a health disparity population. This study examines the disproportionate rates of SLE in marginalized communities, looking at the factors that contribute to these higher incidences of rates and mortality. The study aims to identify epigenetic biomarkers by which risk and resiliency factors affect gene expression and thereby influence SLE in African American women. The study also aims to provide a socio-ecological model of SLE outcomes that integrates a multitude of factors to understand how environments affect SLE and discover underlying causes for health disparities. The study expands on the research of biological mechanisms and factors related to SLE and incorporates socioeconomic, sociocultural, and individual determinants in order to address health disparities. The study integrates the biological and social determinants of health to understand the increased preponderance of SLE in Black women. Interdependencies between genetic background, environmental exposure, social factors, behavioral factors, and epigenetic signatures are together linked to increased SLE in Black women. The study advocates for a socio-ecological model that examines societal, community, interpersonal, and individual determinants in relation to each other to understand and address health disparities related to SLE. The knowledge of how social exposures and determinants can affect biological changes can and should be used to develop psychosocial interventions and measures to prevent and/or mitigate risk exposures and increase positively affecting exposures. Implementation of such actions will contribute to decreasing the health disparities faced by at-risk populations. These studies examine more than just the biological or genetic determinants of lupus, a well-known autoimmune disease. These studies investigate how race, gender, socioeconomic status, environment, and other non-biological factors contribute to lupus incidence and mortality rates. These studies and their authors work to fill in gaps in the scholarly body of work surrounding lupus and provide models for future research on lupus and autoimmune diseases in general. These studies emphasize the importance of studying factors beyond the biological in order to understand why certain populations are more susceptible to certain diseases and certain disease outcomes. Awareness of these factors is the first step to recognizing and addressing disparities within the medical and healthcare system, but also within society as a whole. As seen in the commercial, autoimmune diseases are difficult to diagnose correctly, yet a proper diagnosis is necessary for treatment usually. While this is a problem that all individuals suffering from autoimmune diseases may face, it is important to consider populations that are disproportionately at risk and who may face more barriers in accessing adequate medical treatment. Risk factors related to race, gender, socioeconomic status, and environment should also be considered not only for diagnostic purposes, but to address factors that may be contributing to an individual's illness experience and for prevention measures going forward. Based on these studies and other scholarly work that exists, it is clear that understanding autoimmune diseases like lupus, and likely other medical conditions, require a consideration of the social, economic, environmental, cultural, and individual factors in the lives of patients. Autoimmune diseases like lupus are only one such areas where these issues are overlooked. More work can and should be done to learn more about the origins of at-risk populations and disease outcome disparities. However, this knowledge must be considered and recognized not only in terms of health disparities, but in terms of injustice, discrimination, and inequities on a societal level. These studies show that lupus is significantly affected by external factors that are a byproduct of the society in which we live. Focusing on and addressing healthcare disparities is only one part of the solution to issues such as the higher incidence and mortality rates of lupus among Black women. The sort of critical lens that the authors of these studies applied to cases of lupus are a step in the right direction. This sort of approach should be implemented across societal spheres and institutions to examine and address systemic issues that lead to negative outcomes for certain populations.